In disaster and complex crisis response, we're speeding our capacity to provide services and improving our ability to measure actual inputs and outputs and real results. I was struck from the example of Haiti with the fog of relief, how difficult it is to get real data and information about how many people are suffering, who's getting access, how do we make sure we protect children who are so vulnerable and women in camps when they have huge vulnerabilities. What can we do? So we've learned from those examples, and today we operate differently. We've reinvested in our planning capabilities. Sounds a little bit mundane, but that's how you collect data and information and make smart business-like decisions that ultimately keep women safe in camps. That's how you make investments to put lighting up before the camps form so that those women can be protected. It's how you know to distribute solar-powered flashlights so people can light the way to latrines and safe places and not have to worry about rape or abuse. So we're making those changes, and it's exciting we're doing that because it results in better service and better impacts for our dollars. In education, we looked rigorously at what we do. A lot of teacher training all around the world, which is of course a great thing, but we couldn't tell you a few years ago exactly how many people were we reaching and what kind of actual educational attainment was taking place for poor and vulnerable children, especially girls. So we looked at the data, some of which came from the Poverty Action Lab at MIT and other places, and we've restructured that program. And we're now focused on trying to specifically ensure that 100 million children are able to achieve literacy goals at grade level throughout their primary years. The reason it's so important to focus on that is that's a real outcome. You can measure that and you can ascertain whether the inputs we invest in, teacher training or anything else, is actually leading to more girls being able to read at grade level. And now that we're starting to do this, it's very exciting to see the huge amount of innovation and creativity that our partners and our colleagues have at achieving those objectives. We want to share those insights and make sure that we can promulgate them around the world. In global health, we're moving away from a scattered approach of treating diseases as if they're independent things. No one in the United States, we don't treat pneumonias in one hospital and malaria in another hospital, HIV in a third. That doesn't make any sense and it's inefficient. So we've pursued a global health initiative to integrate those efforts and save money. And in global health, when you save money, you save lives. We're seeing that in Mali, where we put together 4 or 5 different efforts to reach young children with supplements and vaccines and education for families, and we're seeing more outcomes for lower dollars. We see this in Kenya, where through expanding the PEPFAR platform to provide maternal and reproductive health services and family planning, we're able to now reach every district in Kenya with services in those areas at no additional cost. So those are the kinds of efficiencies we're able to drive. But the real opportunity comes from reinvesting those resources saved into the next wave of great opportunities. The President's Malaria Initiative, again started by President Bush, has now generated data from the first 7 sub-Saharan African countries where they invested. Do you know what they found? They found that in countries where we've made significant investments in partnership with other partners, we've experienced more than a 30% reduction in all-cause child mortality. I run around our office saying all-cause child mortality as if everybody should know what that is and be as excited about it as I am. But you all know that means that it's not just malaria lives we're saving. That means the hospitals are seeing fewer kids with malaria and are able to treat other diseases and save their lives from other things. That means that when we're distributing bed nets in communities through schools, something magical is happening in that school because those kids are not just not getting malaria, they're also not getting other things like waterborne diarrheal illness and other reasons that they die in so many of these places. This is important because this is a tremendous part of a bipartisan legacy to make the world a better place and is currently at huge, huge risk.